This is Dili, capital city of East Timor. More than 150,000 people live here. It is a city recovering from the horror of war. In 2002, East Timor was given independence, but the people remain some of the poorest in the world. There is one hospital here, and in a remote district at the other end of town, a lone medical clinic called Bairo Pite. It was the brainchild of a Dr. Dan Murphy, who started it more than 10 years ago. And since, he has been treating in excess of 300 patients a day.
This is Dan Murphy. I'm a doctor in Dili, East Timor, and here we are at the Bairo Pite Clinic. This clinic was started in 1999. At the time, Indonesia withdrew, burning the place to the ground. The clinic's been open since then, and we've seen over 1 million patients. This here is our TB program. That's the #1 problem in East Timor. I would say half of Timorese people have one form or another of TB. A lot of it's inactive, but 10% becomes active. Here in this room we have more people with TB, and you can see we've got fans on all the time. That's our laminar flow, so that we can blow all the bacteria out to the ultraviolet light of the sun, and we try to control the spread of TB that way.
About 90% of Dr. Dan's patients have TB, and 30% have TB in its active form, although now there is a new problem. Many patients have HIV.
Our big challenge here is take care of all the TB, find out which ones have HIV, and try to stop the TB and the HIV. Major challenge for us to do that. Now we're heading towards maternity. We've got family planning here. Maternity now has over 100 deliveries a month. So night times, that's where we are. Doing breech deliveries. Last week we had twins, we have premature babies, miscarriages, anything you can think of we have here. Another important function at maternity is we go to the isolated villages, and the villagers pick a woman to become a lay midwife. And they come here and train. Usually after 3 months, they demonstrate competence in all the areas that we want them to learn. Then we supply them with a few pieces of equipment, and they go out and become the village midwife.
To further improve health in remote rural areas, Dr. Dan runs daily mobile clinics. Volunteers, including visiting doctors, journey for hours into the countryside, attending to the needs of the locals. Patients with severe medical conditions are brought back to the clinic for further assessment. These conditions are often life-threatening, and one of them, unfortunately, is seen on a daily basis.
These are the kind of children we don't like to see. Normally what happens is, as long as the child's breastfeeding, they do well. Then the mother gets pregnant, and they get a new baby, and this one stops breastfeeding. That's when they get malnourished. And you can see that's not normal. I think his arm circumference was something like 10 centimeters. It's very low. I think we're making some progress. I've been here for 12 years now. I came when it was still Indonesian occupation, and things are not what they were like then. Things are much better, but there's still much more to do. Abdominal cramps, fevers.
While most of Dr. Dan's patients can be treated for their TB, many have life-threatening illnesses, such as dengue fever, typhoid, malaria, leprosy, and cancer.
And she can hardly open her mouth anymore. She can only eat like liquids, and it's hard to even get her medicine.
Each represents a challenge, but perhaps the most disturbing illness is one that affects the young and healthy. A terrible disease that is virtually always fatal. But what's most disturbing is that we in the West can do something to prevent it.
That's a good shot. there was a patient here, but sadly to say, even though he was only 23 years old, he died yesterday. His diagnosis was rheumatic heart disease, and he had both mitral valve problems and aortic valve problems, along with congestive heart failure. Despite all the medications that we could give, he got progressively more dyspneic, ended up with hemoptysis, coughing up blood, and went into respiratory failure yesterday, and there was nothing we could do. And so he died. The sad thing about this, and the thing that we all ponder, is it's not that there aren't treatments for this, it's just that it's not available here.
Disturbingly, Dr. Dan has a list of hundreds of similar young patients who will certainly die without the aid of surgery.
Well, this is Ela, 8 years old, a young Timorese girl, and she has the misfortune of having had rheumatic fever. Her mitral valve has now failed almost completely. You can see even when you look, she's not doing very well. She's very frail, and she can't play very much because she runs out of breath. You can see she's breathing deeper than she should. And if you look at her heart, it's working overtime. This all here is part of her chest moving in and out because the left side of her heart is working overtime, just trying to circulate blood. But it can't because the valves aren't working. So here is someone that at age 8 has reached a critical point. Only surgery is going to help her. There aren't any medications that will make this better. When I look at life and what seems to be of value, I always come back to the one thing, that helping each other according to our own capacities has to be a positive thing, and I can't get beyond that. You know? Our goal is good health for East Timor. Our philosophy is access to quality health care is a basic human right, and it should be the same for people everywhere.